asthma, and all it wheezes is not a bronchospasm. The patient may have some mucosal edema, so the airway walls have been swelling, so we'll need to do something to take down that swelling, maybe a corticosteroid. A patient may have a pneumonia. Patient could have pulmonary edema. Again, we may need to look into some sort of medical fix for that. Also make sure that as you're assessing your patient, you're checking lung sounds and rise of the chest. Is the rise of the chest equal? If it's not, patient could have a pneumothorax or a pleural effusion, and of course that would require that we need some assistance from our friends in medicine, and we may need to get the whole team in there to take care of the problem with that patient. So the next slide shows us some graphics of increasing pressure or PEEP alarms due to worsening compliance. So we'll focus on the left side of the screen, and the waveforms on line A, or see if on the left-hand side here we have our pressure, volume, and flow scalars. We're going to focus on the middle one, the volume scalar, because we have a pressure ventilation and our compliance drops, meaning worsening compliance. You can see that the pressure stayed the same because remember that's our independent variable in pressure ventilation. But notice how much the tidal volume dropped because the gas just isn't getting in. Now, flipping over to the volume ventilation side, on line A, we can see at the very top, we're going to focus on the pressure scalar. The pressure scalar is, maybe 25 or so with a regular breath, noticing between A and B that the flow and volume are not changing because they're the independent variables. Pressures are dependent. Compliance has worsened, and now our patient's peak pressure is about 60